So our next speaker is going to be loading his presentation as I'm doing his introduction. It's Dr. Lawrence Ta, MD. Dr. Ta is an assistant clinical professor at the UCLA Center for East-West Medicine, Department of Medicine at the David Geffen School of Medicine at UCLA. Dr. Ta is board certified by both the American Board of Internal Medicine and the American Board of Integrative and Holistic Medicine, as well as in Oriental Medicine, Acupuncture, and Herbology by the National Certification Commission for Acupuncture and Oriental Medicine. As director of the Integrative East-West Inflammation Program, he's collaborating with the Division of Rheumatology at UCLA to utilize an integrative medicine approach on patients with inflammatory joint and connective tissue diseases. So, Dr. Ta.
Thank you, Kathleen. Great. Thank you. I apologize. I just came straight here from the morning clinic in Santa Monica. Fortunately, I didn't run into any Obama traffic yet, but made my way here safely and on time. I just want to thank Dominic for the opportunity to come and speak with you today. Sounds like there's a lot of great work being done here, and I'm all for and believe in the power of patient empowerment. And I think that's really why you're here today, to learn how to better take care of yourself. When I was asked to speak today, it was really sort of open in terms of what to speak about, but I wanted to speak about something relevant and hopefully something practical, and perhaps something intriguing that will cause you to sort of pause and think about another way of looking at neuropathy. Let's pull this thing out before I forget. So what I practice is something called East-West Medicine. At the UCLA Center for East-West Medicine, we see many patients referred by neurology colleagues for neuropathy. I don't know if we have a pointer. We don't have a pointer? Okay. And so I'm not a neurologist by training, but we see quite a few people with neuropathic symptoms, whether it be pain-related, tingling, numbness, and so forth, carpal tunnel, thoracic outlet syndrome, and so forth. But I wanted to speak about sort of a different way of viewing the situation, and perhaps then a different way of handling or approaching the situation. So I know I have a limited amount of time and perhaps leaving a few minutes for questions. In the next 30 minutes or so, I'm hoping to review some of the key features of integrative medicine, present some statistics on complementary alternative medicine, which is CAM for short, introduce some basic concepts of East-West medicine, understand the connection between soft tissue dysfunction and neuropathy, provide you some therapeutic options, and equip you with some self-care. I like to start with a quote, because a quote causes us to sort of reflect. And for those of you who aren't familiar with William Osler, he's considered by many as a father of modern Western medicine, and he's famous for his quotes. This happens to be one of them. He says, "The study of medicine begins with the patient, continues with the patient, and ends with the patient." The tendency for many of us as we go through our training and through the busy clinic schedule is we lose sight of the patient. So it's very important to know about the neuropathy, but it's more important to know about the patient with the neuropathy. And that then leads me to his next quote. He states that it is much more important to know what sort of patient has a disease than what sort of disease the patient has. We can't treat patients like a textbook. We can't treat patients as the average of the norm. We have to treat the patient as an individual, and for that reason, it's important to get to know the person who has, in this situation, their neuropathy. What I'm echoing here is one of the key sort of hallmark features of integrative medicine, that being patient-centered care. It's an individualized treatment, what a researcher may consider something as n equals 1. So what that means is the treatment must be customized to the person, and that treatment may change at different points in time. In order to get to know the patient, one has to utilize a holistic approach. Some of you may be familiar with this term. Now, what this means to me is really getting to know the person as a whole, and that may mean simple things that affect them on a day-to-day basis. So nutrition being very important, their sleeping patterns, their stressors, their exercise routine. What are they doing to help manage their stress, in addition to the medications and the supplements that are taking? All these are practical, important because it provides practical points of intervention when it comes to patient education. Integrative medicine, the question is often asked, what's being integrated? Well, a simple way of answering that is that it's utilizing all appropriate therapeutic modalities, conventional and non-conventional. But when you hear a talk about integrative medicine, it may be about completely different things. For me, when I talk about integrative medicine, what I practice is something called East-West, which is the combination of the best of modern Western medicine with Chinese medicine. But other people may practice things like homeopathy, naturopathy, chiropractic work, mind-body interventions, Ayurvedic medicine, and so forth. So I just want you to be aware that all of that is also out there. Integrative medicine should stimulate the body's ability to heal itself. And the question is often asked, do you believe that the body can heal itself? Some people, it takes a little time to kind of wrap their minds around that, but really, as was alluded to earlier, when it comes to pH, our physiology is all designed to bring our body into balance. Okay? Whether it's our temperature, our blood pressure, our electrolytes, this is something that is not foreign to Western medicine, this concept of balance. So when you get when you get pain, when you get a cold, you don't necessarily see the doctor, but if it takes 2-3 weeks to get better, then at that point you seek intervention, you seek help, right? So what can we do to stimulate your own body's ability to heal itself? That's really important. Integrated medicine should emphasize prevention and wellness. This is really important for all good medicine, but prevention is more than just mammograms, vaccinations, and pap smears. I mean, prevention is when you take something that's sort of non-specific, like fatigue, insomnia, pain, which hasn't really reached a formal diagnosis, and how do you prevent that from becoming something more severe where it then becomes a formal diagnosis? Chinese medicine can do a lot with that. And I think that's one of the things that we're challenged with in Western medicine currently is how do we manage chronic disease and chronic symptoms? Emphasizing wellness. It's more important, it's not just about keeping the patient alive, it's really making the patient feel like they're living, right? That is really what wellness is. Quality of life. Informed by evidence. Integrated medicine should be informed by evidence. We want to know if it works, and we want to know if it's safe. And this is really important when it comes to being embraced within the academic scientific community. Varied in its practice, as I sort of alluded to earlier. So I want to sort of touch upon the background of integrated medicine and why this is really a movement. And just to show that, you'll see cover stories like this on U.S. News and World Report, titled Alternative Medicine Going Mainstream. This was in 2008, really highlighting big institutions like UCSF and Harvard, Mayo and Duke, putting a lot of resources into wanting to know questions like, does acupuncture, homeopathy, and energy healing really work? Is it safe? And what should we be telling patients about these type of modalities? But just so you know that this is not going on just across the nation, it's going on right here in Los Angeles. Same headline, LA Times Health Section 2009, titled Alternative Medicines Become Mainstream. How many of you use some form of alternative medicine, just by raise of hands? Okay. And I think that this is in line with what's being found by the NIH and the CDC. So the NIH, a branch of it called National Center for Complementary and Alternative Medicine, which has recently changed its name to the National Center for Complementary and Integrative Health, as well as the CDC, did a random survey of U.S. adults, and basically wanted to find out how prevalent, how common is the use of complementary and alternative medicine. They first did this in 2002 and found that over 1/3 of U.S. adults have used some form of CAM therapy in their lifetime. They then did this study again in 2007 with a few refinements and found that the prevalence had remained steady, if not, it's actually increased a little bit to 38%. And they found that children had used CAM at some point in their lifetime, about 12% as well, which is probably a reflection of their parents. The study went on to show, well, the prevalence in terms of age. And you can see there already in the adolescent years, infant years, there's already the use of CAM, but really it starts to take off in the adult years. And then it remains steady, quite high, even into the 9th decade of life. And I think this really speaks to the challenge we're facing in managing chronic disease and chronic symptoms. And for that reason, patients, consumers are seeking alternatives to help solve their problems. What are some of the most common therapies being used out there? Well, natural products, non-vitamin, non-mineral natural products is top of the list. Things you'll see at Costco, things you'll see at GNC, things you'll see at Whole Foods and Sprouts. There's also deep breathing, there's meditation, chiropractic, osteopathic, massage, yoga, diet-based therapies, relaxation, guided imagery, and homeopathic treatment. Perhaps some of you have experimented or explored some of these modalities. But just to show that this is not unique to just random survey, this is also happening in patients with peripheral neuropathy. This was a survey done out of Boston, a study done out of Boston that was published in 2003. What I wanted to highlight here is that the use of CAM, which is in this box here, may be a little hard for you to read, but it says that the use of CAM was reported by 77 patients out of 180 consecutive outpatients that were screened or surveyed. They found that 77% of those patients, or 43% with neuropathy, had used some form of CAM. The most frequent were vitamins, magnets, acupuncture, herbal remedies, chiropractic manipulation. And that 37 patients or 48% had tried more than one form of alternative treatment. So this is happening out there, and we as providers need to be aware of this so we can properly counsel and advise our patients. With that as a background, I want to then transition to talk about East-West, sort of our form, our brand of integrative medicine. And to do that, again, I wanted to share a quote from William Osler. Why is the right judgment on this one point, which is the nature of disease, the aim of our medical education and our research, the be-all and end-all of our efforts? Because upon correct knowledge depends the possibility of the control of disease, and upon our views of its nature, the measures for its prevention or cure. Put simply, the way you view the situation, the way you diagnose a problem, is going to affect the way you handle the problem, how you treat the problem, how you potentially solve the problem. East-West medicine essentially allows me to look at the patient through a different set of lenses. Okay? Gives me a different perspective. Western medicine is very valuable, and any talk that you'll hear about integrative medicine should not diminish or discount the value of Western medicine. Sometimes, though, in Western medicine, we can be frustrated. We may not know the answer to the patient's problem. Chinese medicine allows us to look at the patient in a different way. The set of lenses allows us to interpret information a little bit differently and project information, project recommendations also in a different way. So with that in mind, this framework becomes very important. What I wanted to share with you is just some foundational concepts that I think are relevant when it comes to peripheral neuropathy. Now, some of you may have heard the term qi. Have any of you guys heard the word qi before? Okay, I see a lot of hands being raised. And often the question asks, well, what does that mean? How is that translated? It's translated in different ways because in Chinese medicine, the words are characters, right? They're not written words. And really, a picture's worth 1,000 words because there's different connotations. There's different shades of meaning within qi. But put in simple terms, qi is energy. And that energy or that qi is thought to flow within the body. Now, that may seem nebulous at first. That may seem kind of vague. And really, Chinese medicine is not overly scientific because it's been around for thousands of years. So it's really observational. But this concept of qi can become really important in understanding even things like neuropathy. So the question is often asked, well, do you believe there's energy within the body? In Western medicine, there is a recognition of energy within the body. And how do we measure that? We measure that with things like EKGs and EEGs, right? And the idea there is that when there's a flat line on an EKG or an EEG, that is equivalent to death. In Chinese medicine, simply, without qi, there is no life, okay? Chinese medicine is a study and maintenance of normal flow and quantities of qi, right? When we talk about this concept of qi, the precursor to symptoms boils down to fundamentally a qi deficiency and a lack of energy, or a qi stagnation, an excess or blockage of energy. How do you then take that to neuropathy? Well, how do we measure energy when it comes to neuropathy? Nerves are meant to conduct energy. Nerve conduction studies are meant to sort of measure the amplitude, velocity, and latency to give us an indication of how well functioning are our nerves. So nerve conduction studies are a medical diagnostic test commonly used to evaluate the function, especially the ability of electrical conduction of the motor and sensory nerves of the human body. I'm sure most of you who've been diagnosed with neuropathy have done some nerve conduction study in the past, right? The unfortunate thing, though, is that in Western medicine, and even with the nerve conduction study, we cannot always capture the dysfunction within the nerve. And there's many times neuropathy is considered idiopathic. It doesn't mean that it doesn't have a cause, it just means we don't know the cause, okay? So perhaps then, and obviously you have to eliminate things like herniated discs, you got to eliminate a slipped rib, you have to eliminate a structural cause for an impingement on the nerve, but in the absence of identifiable structural cause for the neuropathy, you have to think about the soft tissues. You have to think about the soft tissues, primarily the muscles. What this picture is a muscle band fiber. I don't have my pointer, but that yellow streak down that muscle fiber or belly is a nerve. And what parallels that or runs along with it are blood vessels. And these become really important because the nerves and the blood vessels on a smaller micro level can become compromised when it comes to muscle tension, muscle tightness. So this muscle tightness in skeletal or motor muscles is something we in Western medicine appreciate or term trigger points, myofascial trigger points. Most patients with neuropathy have myofascial trigger points, even though they may not complain of pain. The only way you're going to recognize this is you have to examine and feel for it on physical exam. You have to touch the patient. You have to touch the patient on specific areas that are likely to be involved. How you know where to touch, you have to be aware of trigger points, which is also overlapping with, I'll talk about later, acupuncture points. So what are myofascial trigger points? Some of you may be unfamiliar with this term. It's localized hypersensitive areas in the skeletal muscle. It's most often located in the neck, shoulders, and lower back. Sufficient pressure will intensify or mimic the pain and elicit reproducible patterns of pain referral. What you want to do is get a twitch response, get that point deactivated, which will then lead to relief of pain or symptoms. Trigger points are tight muscle bands. You kind of see here in a blown up view. And really what goes on here is that when there's skeletal motor muscle tightness, that then can compress on the smaller nerves that run through these muscles. Okay? And we're not talking about large nerves, we're not talking about spinal roots. We're talking about small peripheral nerves that run through the motor muscle in our extremities. The blood vessels can also become affected and compromised. We think of, we need microvascular supply in order to get all the way to the furthest ends of the nerves, right? Well, the muscles can affect that. So before I get about can we treat this, we're going to talk about the overlap between acupuncture points and trigger points. Those trigger points that I just described for you actually overlap with something called acupuncture points. That's been well described in the Pain Journal in 1977, back in the 70s, and they found there was a 71% correlation. And in fact, a more recent look at this in 2008 found more of a 95% correlation. This then helps guide my hands in terms of where to feel for these trigger points that need to be deactivated. These acupoints lie on certain meridians or pathways of energy. They don't necessarily are entirely consistent or in line with nerves or vasculature or musculature, but they've been observed in terms of their referral pattern by observation. Qi is thought to concentrate and flow within these meridians, and basically the idea of acupuncture is to release the blockage of this qi. It's kind of like the 405-10 freeway or the 405 and the 101. Basically, when you take the freeway, you have to get from point A to point B and back again. Well, that's what's going on with our nerves. It basically has to send a message and go back again, right? But the area that tends to get obstructed or stagnant, when I talk about qi stagnation, just like the freeway, we tend to cover our brake because we know the 10, the 101, it's going to get stagnant there. And then Caltrans has to open it up to widen the freeway to help the flow of traffic. The same is true with acupuncture. You identify where the qi stagnation is through the muscle trigger point, and you go there with your needle to open up the area to allow the energy to move through. That's in a simple sort of concept. But I want just to show that there is some data, there is some evidence to support the use of things like acupuncture to treat peripheral neuropathy. That actually has been published in this European Journal of Neurology in 2007. They conducted a pilot study to evaluate the therapeutic effect of acupuncture on peripheral neuropathy as measured objectively by changes in the nerve conduction studies and see if that correlated with subjective symptoms. And they found that 16 patients in the acupuncture group, or 76% of them, improved symptomatically and objectively as measured by the nerve conduction study, while 4 of the patients in the control group were helped. So their conclusion is that subjective improvement was fully correlated with the improvement in the nerve conduction study in both groups, and the data suggests that there's a positive effect of acupuncture on peripheral neuropathy of unknown etiology as measured by objective parameters. Just to show that this is not just exclusive to the nerves, that this is also something that can help the local circulation, that then by virtue of opening up the blood supply will help supply the smaller nerves, is that acupuncture can enhance the local circulation. And it's thought to do perhaps through nitric oxide. So increased nitric oxide activity has been found in meridians and acupoints because nitric oxide is a key regulator of circulation, and because change in circulation can affect the development and persistence of pain. There was this study done to see if acupuncture might regulate nitric oxide levels, and their conclusion was that acupuncture increases nitric oxide level in the treated regions and thereby increases local circulation, perhaps providing another potential explanation to helping pain and perhaps an indirect way in which that can help nerve symptoms. Just another study I know because I'm running out of time. Acupuncture in patients with carpal tunnel. Carpal tunnel is considered a neuropathy. It's perhaps better described, but it is another example of a neuropathy. This was a study in a clinical pain journal in 2009 where it investigated the efficacy of acupuncture compared with steroid treatment in patients with mild to moderate carpal tunnel syndrome, measured by objective changes in nerve conduction studies and subjective symptoms as a randomized controlled study. And their conclusion was a short-term acupuncture treatment is as effective as short-term low-dose prednisolone, which is a steroid, for mild to moderate carpal tunnel syndrome. And for those who have an intolerance or contraindication for oral steroids, for those who do not want early surgery, acupuncture treatment provides an alternative choice. Just real quickly, I wanted to show you a couple other studies because acupuncture with a needle is just utilizing a concept of stimulation. There are different ways to stimulate points. You don't have to be an acupuncturist to stimulate points. You can stimulate these points on yourself. And the way that's often done in our clinic is we teach patients how to use a TENS unit. Have you guys heard of a TENS unit before? So TENS is just short for something called transcutaneous electrical nerve stimulator. It's a form of electrical stimulation that can be done on the periphery. So this study was done to evaluate and compare the effects of transcutaneous electrical nerve stimulation therapy on pain intensity and functional capacity in patients with either peripheral neuropathic pain or central neuropathic pain. And their conclusion was that the TENS therapy can be used successfully in clinical practice as an alternative or supportive treatment. Similarly, they did a study with the TENS unit for patients with diabetic peripheral neuropathy. They took 3 randomized controlled trials as a meta-analysis, which is a grouping of these studies, which involved 78 patients. And they found that the reduction in mean pain score was significantly greater in the TENS group than the placebo TENS group at 4 and 6 weeks of follow-up. Their conclusion was that TENS therapy may be an effective and safe strategy in the treatment of symptomatic diabetic peripheral neuropathy. And they suggest that larger trials need to be done. Unfortunately, things like this aren't money makers. Because they're not money makers, there's not large trials to really fund the type of study that we're wanting to see large numbers to really make a more definitive statement. So just to wrap up, I think I have a couple more slides here. This is the take-home slide. Okay, hopefully I convinced you that stimulation can be of importance to help with your neuropathic symptoms based upon trying to identify areas that need to be stimulated. How do you stimulate those points? Well, what we do is in the clinic, we stimulate these points with needles, like acupuncture. It can also be done through trigger point injections, which is to deactivate that trigger point that I described earlier. For patients in terms of self-care, we teach them self-acupressure or self-massage. Right? There's points you can massage on yourself that we would demonstrate for you. The TENS unit, as I described earlier, heat. Heat is another effective way to relax muscle and improve blood flow. And many patients find that their neuropathy tends to get worse when it's cold, when it's damp, or maybe when it's raining. And that's because the muscles tend to contract and the blood vessels vasoconstrict. Okay? So we need to improve blood flow and relax the muscle. So heat can be a very valuable tool, as simple as it may seem. Topical menthol, a simple Bengay Tiger Balm rub, assuming you have no allergy or sensitivity on your skin, can be very effective to stimulate that area to, again, improve blood flow to that area. Stretching becomes very, very important. Stretching of the affected area, not just the affected area, but the limbs that go to that area. So if you have foot neuropathy, you want to be stretching your hips, your thighs, and your calves. If you have upper extremity neuropathy, you got to be stretching your shoulders, your upper arms, and your lower arms too. Got to be careful with strengthening exercises because strengthening or resistance exercises tends to result in more contraction in order to tone and build muscle, but that can lead to more tension. And then patients need to be in tune with their body to find if doing those type of exercises can make their symptoms worse. Lastly, For those who are interested in supplements, there is some data that suggests magnesium can be helpful for neuropathic symptoms, things like carpal tunnel syndrome. It's a muscle relaxant. It's a natural muscle relaxant that, fortunately, most people don't have any problems with sedation or grogginess that you can get with prescription muscle relaxants. As long as you don't have renal insufficiency, renal problems, you can metabolize and clear magnesium well. This is something to consider. It also relaxes the bowel, so people take it for constipation. So patients just have to monitor, make sure they're not going to the bathroom too frequently as a reason to stop the magnesium. But if not, it's something you can safely take daily. Alpha lipoic acid, which was alluded to earlier, for diabetic peripheral neuropathy. Usually studies indicate anywhere from 600 milligrams once a day up to 600 milligrams 3 times a day. Usually start low and you go slow. You start on the lowest dose. That's something to consider, but all of these have to be done in consultation with your healthcare provider. So hopefully from today's talk, we reviewed some of the key features of integrative medicine, reviewed some of the statistics on CAM, introduced the basic concept of East-West medicine, the importance of Qi deficiency, Qi stagnation, and its connection with soft tissue dysfunction, how that translates to potentially neuropathy. Provide you some therapeutic options and feel that empowered you to do something that you can take away from this talk to better take care of yourself. Thank you. You want me to field questions? I think we maybe have a few minutes for questions for those of you who may have any. Yes, right here. Yeah. Yeah. Well, thank you for the question. The question was asked about her experience with trigger point injections with steroids. We do trigger point injections without steroids. There's trigger points that can be done with things like 1% lidocaine, which is a local anesthetic. We use it with vitamin B12, which can be safely injected into a muscle. Studies even show that there's equal efficacy whether you use lidocaine versus normal saline, which really has no medicinal sort of value, I guess. But the idea is the stimulation. It's the stimulation of the needle that goes in to release the knot and the solution that's placed there, whether it's lidocaine or B12 or saline, to stimulate the muscle, providing an acupressure effect, prevent the knot from coming back. So we don't use any steroids, but to answer your question, acupuncture I think could be beneficial, and if you're willing to try trigger point injections, that can be safely done on a regular basis with things like lidocaine or vitamin B12. You're welcome. Yes, lady in the back. Yeah, I don't give personal recommendations other than for people I personally know. The ones I personally know are the ones at our center. We have acupuncturists who work there in conjunction with us as physicians. We work in a team-based approach. So I would recommend, if you're interested, to come to our center. We do have 3 sites, one in Santa Monica, one in Westlake, and one in Torrance. And you're welcome to check out our website. Just Google UCLA East-West Medicine for that. Yes? Mm-hmm. It's perhaps a variety of points. The question was asked if I have neuropathy from the back, the hip, and affecting me down towards the feet, where to do the acupuncture. Acupuncture has local effects, as I alluded to, through local trigger points, but also has distal effects. Acupuncture can do things just for relaxation and stress. I didn't talk, that holistic approach I mentioned earlier, what are the stressors in your life that can affect your physical symptoms? Stress has the effect physiologically to also tighten muscle. So there are points that are used away from the affected area to help relax the body, which have a stress managing or stress relieving effect that can also be utilized. Sleep points, not just pain points, but sleep points, energy points. So to answer your question, there will probably be points used throughout your body. Some patients who have peripheral neuropathy have very sensitive areas, very hypersensitive, so they can't tolerate needles there. If that's the case, we can use points away from the area to treat it. And then you would stimulate those areas yourself through self-care, through topicals, heat, self-massage, to desensitize it, to allow us to use needles in the future in the local areas. You're welcome. Yes. One last question. Thank you. I don't know enough information to really to speak informatively on neuromuscular massage. I do have patients who've tried that, who have found that to be beneficial, but I would say that I'm not in a position to really answer that definitively. I would say, though, you want to make sure you work with someone with experienced hands who has seen patients with neuropathy, because patients with neuropathy, much like patients with chronic pain, is sort of a different situation where it tends to be a little more hypersensitive. You want to make sure you don't overstimulate initially, which can make things worse. Okay. Thank you.